and welcome to the We Got Options radio show with the Doctor and Son. And today we'll be listening to a lecture from Dr. Latasha McElwain about women's mental health.
Hello. This is a presentation that I'm doing for an overview of Black women and mental health. I am Dr. Latasha McElwain. I'm providing this overview for supervision purposes, and this has been pretty much helping to help with the awareness of knowing where Black women and mental health are currently in the state that uh, they and mental health are in, Black women and mental health, just wanting to talk about it. So again, this is for supervision purposes, and we'll move forward. We will show some videos throughout as well, so bear with me as I get my videos going. So the state of mental health of Black women. Pretty much the state of mental health of Black women tend to face significant disparities in mental health, also play multiple roles in society due to the racial and social injustice they face. Also tend to face racism, sexism, and financial equality. A lot of times we don't think about it, but these experiences may make Black women the most resilient group around today. The fact that they deal with all of these different things and still is normally able to show up and will show up. Pretty much, Black women may only be about half as likely to seek care. Also, Black women in the community have that cultural iconic statement that comes along with them, that they are a strong Black woman, that makes sure that a lot of things that we are saying here, that's one of the reasons why they might not seek out help. They are very resilient. um, Also, then looking at when we talk about Black women, there's a psychologist that actually did some research over at Medicine, and with Northwest Medicine Clinic, where she's a psychologist, Miss Ingrid Barnett Ziegler. Looks like she came up with some information in here that we're going to share. And we're going to also share her video as well, her YouTube video. But basically, when you're Black, Black women actually cling to the image rather than acknowledging and addressing the stress and trauma. So many of the individuals, African American women, they tend to experience a lot of they've experienced a lot of trauma, a lot of stress, but they, don't address it. They don't acknowledge it. They kind of keep things moving. They cling to that, iconic, that cultural iconic Black strong woman. They may also experience mental and physical problems. But again, they cling to that, but I'm a strong Black woman scenario, which takes us into lots of thoughts there. So I want everyone to really think about that and consider where that, what you think about that. Some people, and we'll learn this as we watch some of the videos and hear that some people accept it and some people reject it. No, not happening. Not what they are saying they are willing to deal with. The next one here, looking at the stigma about mental health. So basically, the stigma for Black women and mental health, and I will be doing one for Black men as well in mental health and kind of where Black men are. But right now, the stigma for women in mental health is the one that's across the board, probably with Black community, is that it's a stigma. It's stigmatized for mental health in the Black community. Yeah. Also, we got to look at the fact that this creates a great and frequent barrier to finding help because we are trying to encourage people to definitely get help and things like that. But we are looking at the concerns that really if you have that stigma, who really gonna reach out for help. A lot of times, I would tell anyone from my experience in the Black community, working with individuals before becoming a counselor, and still up to this day, it's all about, oh, we don't air our dirty laundry, or oh, we're not crazy, which doesn't necessarily mean that. A lot of us are trying to really incorporate the fact that having mental health or having a therapist or whatever is not saying you're crazy. It's just you're taking care of yourself, just like you go and have your annual physicals done. Um, but talking to someone could be a little bit more frequent. So anyway, moving right along, Black women are more likely to take on the primary caregiver for children, face greater demands on their time, and from the pressures of being a superhero. Black women are more likely, excuse me, to feel sad, lonely, and anxious, because a lot of those things that we just mentioned, I just mentioned them. They're pretty much things that could definitely be a scenario situation where it could make someone feel lonely or make someone feel anxious or sad, like by themselves. That they carry the weight of all that on their shoulders. And then finding time to seek mental health support, because it's just extremely challenging. It's very hard to find the time to do all that. The stigma and the disparities, basically, like, less likely to accept medications. Yes, a lot of us feel like what we're dealing with, and I'm a woman, and I'm a Black woman, so I can say this. You can deal with whatever it is, and if you need help, and I always try to encourage this with just mental health in general. If you need help, having a little bit of something to help you along the way, it's not a bad idea. It's not a bad thought. To get you, snap you out of it. But you do have to, read the fine line. You really have to know the background. You have to know how you would work with this medication, and how you can put yourself in a safe place. Like, I've encouraged individuals that, yeah, you said it's a medication that could cause suicidal ideation. Well, I probably want to look at, if we're going to consider putting that person on medication, then let's talk about, what natural supports you have around family members, things you can do to take care of you, things that you could be more focused on, somebody to be there to kind of be a supervision for you, and things of that nature. If you're going to start this medication that could have this side effect that people get so anxious and upset about, and rightfully so. I can't say it's something silly or weird, but it's rightfully so. So I get it. So definitely, trying to help individuals create that support. you know Also, recent data show that the stigma does not play a role in why Black women do not seek help, but more so depends on prior experience with mental health treatment. I think that is a big statement to make. And I think it's because a lot of times I have talked to individuals who have experienced some mental health treatment situations in the past, and it hadn't been that great. Not that it's been the worst, but it hadn't been that glorious or that nice, or people not being definitely attentive, or people not being culturally responsible for what they're saying, or what they're as they're dealing with someone. So lots of goodies to go along with that one. So
And on that note, we'll be back with the We Got Options radio show with the doctor and son.
Dr. Latasha McElwain's professional consulting services. Dr. Latasha McElwain has become an elite and esteemed professional in her field of counseling psychology. She provides consultation in counseling and business practices, as well as providing supervision, consultation to professionals in North Carolina, South Carolina, and Georgia. Please reach out to drlatashamcElwain.com, 704-492-1105. Want to move right along. Talking about Black women and risk factors. So we're talking about Black women and risk factors. We're talking about several different things. We're talking about traumatizing responses to things. We're talking about the survival mode. That's kind of generational, but that's still something where people end up falling in survival mode. Family related stress, that's a huge piece as well. And I'm only given this presentation from a all of this is pretty much research, but a lot of this is research, but a lot of this is me ad-libbing a little bit of, just personal things. I'm a Black woman, so I feel like I can talk about it. I can give a take on it, and I could probably get some good feedback from other individuals that want to, share about it. But as Black women, I think a lot of times we don't think about the social stressors that is due to different things, like in especially workplaces, racism, we go out and do things or whatever, and gender. Um, there's a lot that happens and goes on, about how we're treated. Health issues, other health issues that come along, occupational concerns, code switching when we're at work. We have to kind of go through those. I mean, a lot of people tend to do a lot of that code switching and things like that. I tell people a lot of times I don't. If I'm going to say something, I just say it. I try to be as authentic as possible, and kind of it is what it is. I love doing what I do, so I'm pretty spoken and outspoken. And then microaggressions, dealing with some of those. I'm one of those persons. I hate to be the one to say this, but I'm one of those persons. If I see it, I will probably, stop someone and say, "Hey, that's not cool," or I'm that person. I'm that person that'll probably get called in the HR because I actually stopped them and told them that and tried to explain to help them not to put them in that scenario where they're being tattled on for no reason. I'm just trying to have a face-to-face conversation with them, and that person might not feel comfortable that I just did what I did, but I'm a person straight from the horse's mouth. I'm gonna tell you what's up. So with that being said, a lot of things go on in occupational, especially in corporate type positions. I have experienced a lot of it. So I am also speaking of experience versus just all research here. So when we're talking about stressors dealing with relationships, a lot of times that's something that folks do end up struggling with for the most part. Concerns with social justice. I want to hit back on relationships right now. Stresses in relationships. I see a lot of Black women that are really climbing the ladder and climbing higher than their husbands. So that could be, are their partners, and that could be something that causes a little bit of a concern as well. But back to concerns with social justice, just different things that go on in the world, and seeing these things happen, things that happen right there in our neighborhood, right in front of our faces at work, and things of that nature. Financial issues, there are concerns as well. Definitely trying to take care of things. And then cultural expectations of being the strong Black woman. Here we go again with the strong Black woman that can lead to anxiety, depression, hypertension, diabetes, heart disease, and more other health, physical health matters and things of that nature, as well as more severe mental health disorders. Okay. So, what are some of the other risk factors that we can think of? And I put that question out there. I posed that question because that's a good way to start thinking. Like, what are some of the other things that, of course, some of the individuals that will be listening to this presentation, you will be a Black female, and so you might have something totally different than what we have on this on this list, and that is marvelous. That is wonderful. I would love for you to share it. If you drop it in our comments, or if you hear this and then you're communicating with me later on, or whatever the case may be, do so. Tell me how, add it to the list as more research that I'm doing in regards to this this issue, this concern. So moving right along here, let's talk about the barriers of mental health care for Black women. When we talk about the barriers for mental health care for Black women, limited providers was the biggest one. Of color, providers of color. Oh my goodness, there's a lack of providers. Culturally competent care. According to the American Psychiatric Association, Black clinicians are only 2% practicing psychiatrists and 4% psychologists providing care. That is, oh yeah, yeah, that's a lot. So want to hear that and say, okay, yeah, that might be something. That's an area that I can remember starting off in my career and telling my grandmother I wanted to be a therapist, and she was like, "Girl, who's gonna air out their dirty laundry to you? Who's gonna tell you that? Nobody don't do that, And she said it straight up: Black folk don't do that. And I understand what she was saying, but it was something still that I knew that I wanted to jump into because I knew that I could be able to help people. And once I told her that, she was more open to it. But she never really jumped on that whole idea of me being a therapist. And this was an individual. My grandma was born in 1939. So yeah. All right. The lack of um, Black mental health providers make it difficult for Black women to find therapists that can connect with them, as well as would understand their lived experiences, as well as cultural perspectives. So there are a lot of things that, I tell people a lot of times, you say one thing one way, and somebody else take it as something else. So that's always, kind of like that code switching. But, like I said, I'm a person that don't code switch. So if you take it where you take it, I'm going to tell you what it is. And it doesn't mean that. But, having somebody being able to, understand you culturally and your, cultural perspectives, different things of that nature, that is what we go to school to learn as any therapist or any psychologist or psychiatrist. We all learn those things. But, as we go through life and things of that nature, you know, we we could remain culturally competent, or yeah, sometimes things change. So for the most part, that's one of the big things I try to do is stay culturally competent around the race, genders, everything in my field. I try to be more able to work with just about anyone. And if I have never worked with an individual and they're, you know, dead set on me, then I tell them, hey, work with me because you're a new experience for me. And I know you feel that I am so competent. I am in a lot of different ways, but I really want to since you want to be with me, I would want to be able to provide you that service. So I make it, this is a learning experience for both of us. So if I say something, then you would address me, and we can kind of go from there. And I pray I don't say anything, but if I do say it, I want you to educate me. And I find that a lot of my younger patients and clients that come through and hear me say that, they're like, oh my, I can deal with that. She's being genuine, she's being 100. She says she know, but she know a lot of book stuff. She might not have the lived experience. So but yeah, that could be also a pretty much a defining factor for a lot of individuals in general getting mental health services or getting services, period. So, racism and discrimination in healthcare, that is also something. Just had looked at the research where, the World Journal of Psychology Review, that Black patients are more likely to be diagnosed with schizophrenia at a higher rate than their white counterparts. So basically, with the same symptoms now. So basically, people are not really realizing that, this is one that I always tell everyone that works I guess, my nerve when it comes down to women. We would be diagnosed with uh, borderline personality disorder, or some of those things around that area. And I always tell every psychiatrist and doctor and everyone I work with pretty much in the hospital, what teenager do you know that is not able to be diagnosed with something like that between the ages of, some of them even start at 12 to say 23, 24, 25. I don't know too many, but yeah, everybody got a lot of those those symptoms that could possibly meet criteria. But does it really mean that person is borderline personality disorder? First of all, we can't even diagnose them with it normally before the age 18 anyway. So I always tell people and tell other professionals, don't give that person a bad rap. Don't do that. Make sure you know what you're doing before you start just blowing those things out there. And I say it to the psychiatrists and the higher than mental health therapists, because those individuals are the one who really jump more into personality disorders. So I'll be telling them in a minute, don't take it light when you're doing stuff like that, because that could really do some damage to people's mindset, thoughts, moving forward in life, the whole nine. And could be typically normal by 25, 27, typically, average at that point, when it comes down to their emotions and everything else. And this whole hormonal time has already passed, because a lot of it has to do with that. To me, a lot of it has to do with that. But Some people can beg to differ. I'm just a therapist telling what I see and what I know and what I've experienced. Okay, moving right along, the American Psychiatric Association reports that African Americans are less likely to be offered medication and therapy. That is hard to understand, but I totally get it. Yeah, why would someone not, offer someone that type of support and that type of care? Have no idea. But these are the things that we have to work with in our community to continue to get things moving in a right direction for not just African American women, but for Black women, Black men, Asian families, the whole nine, everyone, everybody in general. So with that.
And on that note, we'll be back with the We Got Options radio show with the doctor and son.
Insightful Options PLLC, providing counseling, consultation, and DWI services in North Carolina, South Carolina, and Georgia. Contact us at www.insightful-options.com 704-492-1105. We'll move down to the barriers to mental health care for Black women. We'll go to the next one for that one. And that one also talks about other things that may influence barriers. You could have accessibility, location, transportation issues, not insured, underinsured, financially stretched. You could definitely have the available services in areas and things of that nature, the services that are being offered. Also looking at social issues with children, being a caregiver of older family members, mother and father, grandparents, and things of that nature. Poor quality of care and cultural matching. Again, unable to locate a racial or ethnical minority provider. And then we're looking at what are some of the other boundaries that we missed from this list. And I wanted to put that question out there again, because I think people don't realize that some of that lived experience can bring up a whole nother gamut of things that are happening and going on that could be very, very useful, mindful to know as, providers and professionals out here, because it could be pretty unique situations. It could be something totally off the rates for or the charts for everyone else, but definitely normal in some individuals' lives. So definitely there are a lot of barriers out there. Any additional barriers we can definitely add to this as we continue to go. The next one here is talking about why is mental health important for Black women? Oh yeah, so why is it important for Black women? Black women tend to experience, many Black women experience um, anxiety and depression. One of the key ones, anxiety and depression. Also, we also look at the fact that Black women encounter unique barriers. Finding culturally competent therapists that can work with them. A lot of times you find that Black women often experience both racial and gender discrimination. We also realize that some Black women may not be aware of what their emotions are and the symptoms, as as it relates to anxiety and depression. They just know they're sleeping all the time. They just know that they're on edge, they snapping, things like that, and they're not even putting the two together. They're not even correlating nothing. They're just kind of, I'm just having a moment. And I say that also to say women in general, along with the hormones and everything else, again, a lot going on. It's my time of the month. I'm sleepy, I'm tired, I'm more restful, I'm more, you know a lot of things go on. Some women start going through menopause. Some women start dealing with the fact that, oh my goodness, I might be pregnant. Who knew I was pregnant when I was acting like a crab the whole time? So yeah, there's a lot to think about there. And we won't a lot of times look at all these different medical things that are happening or going on, these hormone things that are going on, and we don't even realize that we're in a state of depression or a state of anxiety. Going back to the researcher we talked about earlier, Burnett Ziegler, she basically mentioned that described the different types of Black trauma, trauma that Black women often endure. I wanted to add these to it because I think that was very important for her to say that, and we'll see her again in a video that I have attached to this. Intergenerational trauma, things that happen in families and kind of goes on with the family and rolls on with the family. childhood trauma, things that happen, in your childhood, things that, come up that are unexplainable or you can't understand and no one else to explain it to you as well. Abusive relationships, pregnancy trauma. Now we've been coming out lately about a lot of different things with pregnancies and miscarriages and things of that nature. And that's a hard pill to swallow as well that at times we don't talk about. And then through our own personal stories, the young lady who presented this information, she just gave a lot of good stuff through her own personal stories and family members and clients, the stories that she talked, from working in the field, being a Black woman, and having family members that are Black women. So um, my question at the bottom is to tell why mental health is important for Black women that did not make this list. So, what are things that you think didn't make this list? Why is it important for Black women to have, their mental health intact and for it to be important to them? I'm going to go on a different rant when we're talking about raising children. I think it's very important for us to think about why is it important for a Black woman to be able to get her mental health in check and focus on her mental health and make sure she's in a good place to raise more productive children, making sure your children don't have to live with that generational stuff. Well, mommy was sad all the time. Now I'm sad all the time. I can remember, and I'll just share one experience that one day my son told me at a very early age that he was depressed, and I was looking at him like, "Where did you get depressed from? Oh my gosh, where did you get that word from? Did you hear it from me? I don't think so, but where did you get that word from?" And then I realized he heard it from my mother. My mother said that she was depressed all the time when I was a kid, and my mom had my son the first 5 years of his life. So what was I to think? He heard it from grandma. So we got over it, of course, and we talked about it. But that's me just being, wanting to be a mental health professional back then and being very, very aware of mental health. So with that being said, I mean, I could probably say that I was definitely the first Black woman in my family to even think the thought that I might be dealing with a mental illness as such as depression or anxiety, and the only one that's probably think the thought of taking something for it. And that goes along with the fact that I have, yes, it put myself in the field, working in the field as a professional and making sure that I am taking care of myself. Because I always tell people I cannot continue to fill all these tea cups around me if my teapot runs empty and dry. That's my saying. So, with that being said, yes. So there are many important reasons why Black women should definitely look at mental health as an important part of them.
And on that note, we'll be ending today's episode of We Got Options Radio Show with the Doctor and Son. But come back next week where we're going to finish the lecture with Dr. Latasha McElwain.
Hi, this is Dr. Latasha McElwain with the Green McElwain Foundation. I have teamed up with Our Special Journey, osjourneys.com, in order to provide a Just Breathe retreat. And it is to find your inner self health and wellness retreat. It will be in Belize. The dates are May 21st through May 27th, 2024. For more information, please check out us in the information on osjourneys.com.